My name's Steve Baker. I'm the MP for Wickham, Deputy Chairman of the COVID Recovery Group. I'm really delighted to be joined by Professor Paul Dolan of the LSE. He's got a paper coming out talking about the trade-offs involved in coronavirus policy. Paul, why don't you tell me about your research?
Yeah, thank you, Steve, and nice to be able to speak to you. I think I'll start with one of the most profound behavioural biases that exists, and it's called situational blindness. And it's the idea that when we pay attention to something, it's important because we're paying attention to it, but it might not necessarily be what we ought to be paying attention to in terms of what really matters, right? So we actually saw this a lot in the airline industry, for example, where planes would be taking off without co-pilots sitting next to them, right? They'd be checking all the instrumentation, they're paying attention to what matters, but not paying attention to what like really matters is whether they've got someone sitting when the plane takes off.
You wouldn't have thought that could really happen.
I know. Well, it is quite frightening, but there's some really obvious interventions that would overcome those kinds of biases. And airline industries and surgical operating theatres and elsewhere now use very simple checklists. They have a list of really important items that everybody has to look at and check off before they take off the plane or before they do surgery or whatever the outcomes are. And I think that what we've seen in response to COVID is a magnification almost of that situational blindness, that we've paid attention to what's important because it's in front of us, because it's salient and it matters at the time, which has really been entirely transmission rates and mortality risks. And it's meant that we haven't drawn our attention away to look at all the other things that matter too, all the other impacts that some of the policy measures have had on people's well-being, their mental health, young people, life expectancies of people later down the road. All of these things that we know matter to policymakers and to citizens haven't been factored properly into the discussions.
Yeah, so normally this is the stuff that Parliament discusses all the time. Of course, Parliament does. It's always aware of the impact on the poor or concern for people's mental health, and you would usually expect people's rights to be upheld by Parliament. But in the crisis, I can really see what you mean. And my colleagues and I, we've always been saying that this is a really complex optimization problem, recognizing that there are trade-offs between different aspects. So, okay, given that there's this situational blindness, what does that mean for forcing policymakers to engage in trade-offs? And what do the public think about those trade-offs?
That is an interesting question. So I guess this is more for policymakers to work out, because I'm not really sure of the answer myself, whether I want to do things slowly or quickly. But let me go to the conclusion, and then we can discuss maybe the processes by which we get there. In the end, it seems to me we want to be evaluating all policy impacts, both during times of crisis and also calmer times, according to their well-being impacts. Not just their well-being impacts at any one moment in time, but over the lifetime. And I say that because if I take a step back, every one of us, you, me, and everybody else, is an egalitarian. We all care about equality of something. The question is of what?
Yeah.
And for a very long time, I've been committed to reducing inequalities over the lifetime. I don't care just about a snapshot of whether the world is unfair at any one moment, but whether it's unfair over an entire person's lifetime. And that requires us to fully capture the well-being impacts from birth to death. Now, that's the final consequence. And in the paper that we're going to be putting out tomorrow, we're going to set out how we might measure that and the processes by which we might go through to achieve it. But that's the final consequence. But I think, so do you want to say something at this point, or should I keep going?
Well, no, so I'm just thinking about the equalitarian point of view. So I'm an old English liberal, like working class liberal. Now I've become very middle class, right? So I'm very, I know that.
You and me both. You and me both.
So I'm very conscious when I think about working people, some of whom have had to stay at home and lose their income, particularly if they've been working in the hospitality sector or tourism or other areas that have just been shut down by the government. Meanwhile, other people like myself have been able to sit at home on the same pay, perfectly comfortable and safe at home, with no some inconvenience. You know, there's plenty of hobbies I've missed out on. It's not very nice. I don't like it. Certainly feel the pressure that my liberty's been constrained, but I've saved money, and it presses upon me that while I've saved money, others have suffered. And I think that's true of a lot of policymakers. So one of the things I'm worried about is that you're right. A lot of us, I seek the moral, legal and political equality of all people, their equality before the law and justice in the process of living. And it sounds like we're not a million miles apart, because I've always felt it was both and. You can't neglect the inequality and injustice of leaving people in poverty. So I'm saying too much, but I'm really interested in this idea of how we deliver justice in the process, and somehow recognize that some of us who are making the decisions are sitting quite comfortably at home, while others possibly really quite uncomfortable and suffering quite badly as a result of lockdown.
Yeah, so you make a really important point about the processes by which we get to the final consequences. And, you know, we know from a range of literature that diversity in decision-making leads to better outcomes. That's been established across a range of different contexts. In relation to the pandemic and policymaking generally, it's not just diversity of characteristic, which is what we will often focus on. It's not just diversity of perspective. It's also diversity of experience. And I think, you know, you mentioned coming from a working class background. I do too, and I still retain a lot of the working class beliefs, values, behaviors, and friends. And so I see directly some of the impacts of what we've been doing on people's lives. And I worry that, as you do too, it seems, that the policy, you know, I mean, look, policies have been made, not just in the UK. This isn't a UK only problem. I think this is an international problem too. That the people making the decisions have, almost without exception, been able to work at home on full pay with full pensions, and by and large in actually pretty nice homes too. They've also been pretty much our age, right? I mean, if you think about it, sort of plus or minus 5 years, that's pretty much everybody. And it's also the point at which I think we face the most existential dread. You know, you and I are both now being reminded of the fact that we're not going to live forever, right? When we were younger, we didn't think about dying, you're going to go on forever, right? Older people, and it's actually worth talking about older people at some point too. Yeah. Older people have in many ways accepted that they're not going to live for another 50 years and actually want to live the remaining lives in quality. And I think that, so it's a really interesting question about for whom some of these policy measures have been put in place for, right? We've talked a lot about how young people have been adversely affected, or, you know, lots of people have said this quite frequently, but also there would be, I think, a really important point to consult with the older people for whom many have been unable to see family and friends for the last year or more. Yeah. Is that what they want?
And we know people's welfare has collapsed in care homes, don't we, when they've been without human contact. I mean, I'm afraid I've got anecdotes rather than data, but you know, there are plenty of anecdotes around about people's folks' welfare.
Well, I think it speaks to the assumption, and I, you know, probably level this charge at you as much as anybody else, is the fact that politicians kind of often know what's good for people without any proper inquiry into whether that actually is. And I think that, again, that requires us to take well-being seriously. We need to be engaged in proper inquiry into how our policy decisions impact upon the real experiences of real people.
Yeah, I hope you won't mind me saying my politics is that for the most part, I'd like to leave people alone and get out of their lives. But yeah, I think liberalism means respecting the liberty and dignity of other people, and that means me not telling them how to live. But that's just by the by. But you're right, of course you are in the round that politicians think they know what's best for other people. And I certainly recognise that.
Really, sorry, just to say, I think that's a really, because I feel like I've gone on my own personal journey during this last year. I mean, if you're, you know, faced with the choice between security and liberty, I mean, insofar as those two things are traded off against one another,
often are, yeah.
I've been surprised, maybe is to put it politely, how much people have favoured security over liberty, not just in policy making, but it seems in the general population too. And we can have the discussion of the reasons why. But that's been a really interesting insight for me. So I find myself, as a personal journey, feeling a bit more comfortable towards the liberal end of the spectrum than I thought I might have been pre-pandemic.
Yeah, yeah. I think we've all been on a bit of a personal journey, different times through the last few years. But that's another story for another day. So let's talk about. So I think a lot of politics is about this trade-off between security and freedom. In fact, there's definitely a book over there about exactly that, quite a thick one. So why do you think it is that people have been so terrified? Is it because they've understood the disease correctly, or have they been frightened by the government, some other factor at work?
Yeah, it's a good question. There's a number of things. I think let me just say maybe just a couple of things that come immediately to mind. I think one is that fear has obviously played a significant role. I mean, fear is a motivator for action and often inaction, right? I mean, if we're scared of something, then we don't act in a particular way. So we haven't wanted to engage in some of the liberties and freedoms that we might otherwise have taken for granted, and would be much more supportive of policies that provide security. I think there's also the fact that we've heard the words unprecedented pandemic. It's been used a lot, and in unprecedented times, we look for ways to resolve uncertainty. And one of the ways in which we do that is to look what others are doing, and so we follow the behavior of other people. And because Wuhan, for example, was so quick to lock down in the ways that it did, that without doubt had a spillover effect on how other nations considered the appropriateness of their responses. We almost got into a position where it was almost became an arms race of signaling how much you cared about the virus by the degree to which you were willing to restrict liberties. And if you didn't, you weren't taking it seriously enough.
Yeah.
I think there was as much, that's not only or even the politicians' responsibility, that's down to the public too. I mean, there was a real public appetite, I think, for some of the measures that were put in place, because we looked to other countries who seem to be taking the virus more seriously.
Yeah. You've been kind enough to let me have a look at an advanced copy of your paper, which is really, really interesting. Can you tell us a bit more about what you did in this research and what you learned from it?
Well, so there's two things. One is we're putting out a paper tomorrow, which is to make the case for why we should be doing wellbeing impacts assessments. And I have a range of co-authors, including Gus O'Donnell and Richard Layard, that we're kind of setting out how we might use wellbeing as a lens through which to look at policy decisions. And I think, actually, just to say a little bit more about this, is it doesn't even actually matter whether you do that or not, almost to start with. It's actually thinking about it and framing the discussions in that way. And I think we've got to a position during the pandemic, in my mind, I don't know whether you would agree with this, where considerations of life experiences, in addition and alongside life expectancies, have almost become like a luxury good or an afterthought.
I would agree, absolutely.
As if the idea is of people having good lives is kind of something that we can worry about later whilst we deal with immediate risks to mortality. And so the trade-offs have become completely disproportionate.
I think that's absolutely right. And particularly the young have been neglected. There are people who feel they've missed out on a year of life when they were young. And that's a big deal for them. And it might be easy for some to scoff at that. But if people have missed out on a year of dating, or they've had to put their wedding off several times, that's meant their family formation has been delayed a year. And these things, and that might mean that their grandma wasn't able to make it when she might otherwise have done. And these are big deals to people. So I don't think we can scoff at the consequences for the young who've missed out. And life experience, I agree, it has been neglected. Yeah.
Well, it's also the case, even if you want to frame these things in the terms of reference of health, which has been our principal focus throughout the pandemic, we know that if you were to rank things that affect your life expectancy, from top to bottom, then, well, probably giving up smoking. That's kind of right up there. Loneliness sits right alongside it. Diet and exercise and all these other things, they're way down the list.
That's a relief. That's a relief. Speaking as somebody who's spent too long sitting here.
Yeah. I'm not sending the message that people shouldn't care about these things, but it's like if you really think about only the health impacts, let's leave all this silly well-being stuff to one side. If you only cared about health effects, you would be really seriously concerned about loneliness, because it has a really significant causal effect on people's life.
And is that across the age range? Is that at all ages, or is that especially the old? Or?
Across the age ranges. I mean, it has a physiological and psychological effect on you.
Yeah.
So that it has a deleterious effect longer term. And so, so even if we didn't care about well-being, we would care about it in health terms. And just to sort of pick up again on your comment about the young, it reminds me of, you'll be familiar with this term in the business environment, where people talk about survivorship bias.
Yeah.
That's the idea. You walk down a high street in the days when, we could go into cafes and bars, and you'll see successful ones that will fall, and you think it's very easy to make money from running a bar or a cafe. You don't see all the ones that have closed, that have failed, that were unsuccessful. And the same thing applies to some large degree with dying, in that we only ever observe the people who have survived long enough to require the interventions and treatments later on. If we're engaged in policies that will be significantly shortening not only the life experiences but the life expectancies of younger people, then we're going to see those people dying much sooner than would otherwise have been the case. But we don't notice them because they're dead. So we only ever notice people when they're in the stages of life where we can pay attention to them. And I think that that's why it becomes fundamentally important that we pay attention to the process of dying, and not just dying. I mean, because, death and taxes, they're the two certain things in life. So the proper question really ought to be how we manage those, not how we try to deny them.
Yeah, I'm starting to think, as I listen to you, that framing this overall question of how we should respond is going to be fantastically complicated, because there's questions about valuation, about people's preferences, questions about how you examine lives, livelihoods, well-being, questions about the justice of people's lives and what that means for their longevity and the quality of the life that they have in the meantime. And a lot of this will just get swept aside again if we have another pandemic that looks like it's overwhelming the NHS and killing tens of thousands of people. So what do we do? What's the main lesson for ministers? Because I mean, I'm in this privileged position as an MP. He still does talk to me, Matt Hancock. So I could say to Matt, Secretary of State, maybe you might like to consider this. So how do we frame the work that he needs to commission in order to make sure that if there's a next time, our policy response is much more situationally aware, and in a sense, we don't take off without the co-pilot, and we do consider those other impacts on other people?
Yeah, look, I mean, you're just as well a better place to be able to ask this than I am, but there's a couple of things. One is in relation to the measurement. I think we need to be, if we don't measure it, we don't value it. We've been presented regularly with updates on transmission risks, transmission numbers, and mortality rates, hospitalizations. They're very simple, easily presentable pieces of evidence. They're never placed in context, by the way. I mean, that would be one thing that would be, I mean, we are at the stage, I have no doubt, where excess deaths is a concept that people would understand.
Yeah.
A year on into a pandemic, a month on, we would get what excess deaths means. So even placing those numbers in context would be a significant advance.
You've made me think about the misallocation problem, because people have, and we've all done it at different times, I think, people have misallocated harm to lockdown when actually COVID was the cause. So classic example, cancer treatment. The NHS has stopped treating cancers often because it had too many COVID patients in it. And it was COVID getting too high that stopped cancer treatment, not lockdown. But on the other hand, saying to people, protect the NHS, is also thought to have prevented people going to hospital to seek diagnosis for various conditions, including cancer. So isn't it a very complex problem to try and allocate the harms to causes through a crisis like this?
Yeah, well, yes, of course, it's a hugely complicated problem. I think that, I mean, that's an interesting question around the messaging that stay at home, protect the NHS, save lives, is that, first of all, to touch on something we said earlier, the stay at home message. We have this nice, warm, fuzzy place when we think of home, don't we?
Yeah.
But actually, stay at home as a message for people in vulnerable households is a really problematic message. You know, it's why I was very outspoken early on the closing of schools. Schools are places where many kids go, where they get care, attention, comfort, food, where the schools notice when there's issues at home. So stay at home removes all of those support barriers. Protect the NHS, as you rightly say, is then a message that says, basically, don't go to hospital even if you've got something really seriously wrong with you. Cancer, strokes, heart attacks, and so on. So there needs to be more understanding of the unintended consequences of the interventions, as well as the intended ones. And you expect behavioural scientists to say this, but we need more of us, more people like me involved in the decision, informing decisions. We're not going to make the decisions, you politicians will, but informing the decisions. And that advice needs to come from a much wider range of disciplines than has been the case hitherto.
I can absolutely
we've actually shown with SAGE and other agencies that you can get good expert advice. You're getting good expert advice from a very narrow perspective. And so it's possible as we move forward that you can get good expert advice from a much wider range of disciplines and expertise and experiences.
Yeah, and that would help inform the messaging, I think, because one of the things I think ministers would say is that they've put out protect the NHS because they wanted to keep it available to treat people when they needed it. But that part of the message seems to me to have been lost. People have been protecting the NHS, not as an end in itself. So isn't there a classic problem? It's not what A says, it's what B understands. And in this messaging about protect the NHS, people have not always understood that they should still seek treatment. I know I've had it on my local radio programme that presenters have been very keen to help me to give that message. Still go to the NHS if you need to.
Yeah, and I think that what's happened is, again, that, you know, the media plays a big part in this, and politicians are responsible for it to some large degree, is that we create these very polarized positions, right? So we've seen in response to restrictions, unless you're, you know, either you're in favor of the hardest possible forms of lockdown, or you're a COVID denier. Either you're in favor, you know, and of course there's a spectrum a long way in between. There's very few people that would want no restrictions at any point during the last year. The question is, where's the balance? Have we got the balance between security and liberty and the impact upon mental health and all these other things that we've been talking about, right? And that's the sensible grown-up conversation, rather than being forced to either pick a side, and if you don't pick a side, you're assumed to be an extreme representation of the other side. And we see that happening. We saw it with I know an issue close to your own heart, Brexit. You know, you either had to fall into one of two extreme camps, which was a federal Europe or a hard Brexit. It wasn't possible by the time we had the discussion fully to kind of have a more nuanced, balanced position, because you had to pick a side and stick with it. We've seen it in relation to discussions around compliance. You know, either you're someone who has fully complied with the lockdown measures at every moment throughout the last year, or you're a COVID idiot at a 500-person rave.
Yeah.
Well, you know, most people have managed their way through remarkably well, sometimes breaking the rules, maybe when their mental health has been put severely at risk. And then they're neither a strict complier nor a COVID idiot. But it's the way that we manage our way through a challenging situation. So I think there's a prospect of I'm optimistic about us being able to have a more grown-up conversation.
Yeah, we'll have to have
that force us into one camp or the other.
talking about grown-up conversations, we'll have to have another conversation about Hegelian dialectic of narrative in the news, because it always feels to me like they're going for synthesis and then antithesis, and then thesis, antithesis, synthesis, but they need these extremes to try and help this narrative make progress. And it was always mad when it informed public policy for the hard socialists, and it's mad today. But I slightly fear that that's what's going on when people are picked to give commentary on the media. It's like nuance is considered boring. But there we are. Now, we're kind of coming up to using about the right amount of time.
Yeah.
What would you like to achieve then? Your paper will come out. Gus O'Donnell, you said, is supporting it, and he obviously man of impeccable credentials at the very top of the government machine. What's the main thing that you would like to achieve from this paper coming out over the next few days?
Well, I'd like people to read it. That's that's an obvious start. I think there's a couple of So I mean, it's the point about taking measurements seriously, and measuring the things that matter, being able to provide quantifiable estimates of those things, which include the wellbeing impacts. But I think in terms of processes, I think we need a couple of things. I think we need something like and I don't want to keep recommending commissions and agencies and bodies and authorities, but I think that's what we need. I think we do need like some sort of wellbeing impacts agency that would more properly consider some of the trade-offs that are being made across different areas of harm and benefit, not necessarily with a view immediately to quantifying them in monetary terms for the purposes of cost benefit, but just so that we're alert to them when we're making the decisions. Just even just thinking about being more comforted that knowing when we've gone into some of these lockdown measures that there's people who truly understand the life experiences of young people and children who are being asked to stay at home would be a start.
Yeah.
And then I think we need a wellbeing commission. One of the things I feel a bit frustrated in myself in this is that a lot of the wellbeing evidence is like really obviously good for people. It's not like I'm some paternalist judging them, because I'm kind of, increasingly in that liberal view of the world, but people, like, lots of these things are actually good for people's lives. So why isn't the public more galvanized and interested in assessing well-being more directly? Maybe I'm not communicating myself well enough as an
So
academic.
I'll tell you what the fear is for people like me who are verging on the libertarian. The fear is that well-being economics strays into this idea that everybody's going to live their life in the embrace of the state. And we touched on this before, the idea that politicians think they know best for other people. And I shrink in horror at this idea of living my life in the embrace of politicians and officials telling me what's best for me. But I don't think you mean that. I don't think you mean that at all. I think you're trying to work out that where people are really having a miserable time, public policy should be better at getting alongside them and lifting them out of that place. I don't think you're actually saying that everyone needs to be living their lives in the embrace of the Wellbeing Commission. That's not what I don't think that's what I've taken from you before.
No, thank you. I'm glad you enabled me to clarify that, because that could be taken as the view. Look, I mean, a lot of the behavioural science interventions that have been used, various nudges and shoves, have really been about trying to make people more middle class. I mean, that's really what they are in because we know what's good for people, right? And they would also appreciate it if only they acted like us. That's not the kind of interventions that I'm interested in. The ones I'm thinking about is actually whether they do directly show up in people reporting having better lives and better experiences from when they've been nudged and shoved. And that's actually, from the academic perspective, for me, as someone who works in the behavioural sciences as well as happiness and wellbeing research, remarkably absent data. You would expect, if you're going to do something to somebody, that you might want to inquire whether what you've done to them has made them feel better off. And actually, of course, equally, how we feel affects what we do. So I'm committed to a proper account of welfare that accounts for, the well-being consequences of what we do and how what we do affects how we feel. That's fundamentally what I'm interested in. I'd like to think that I'd allow the data to speak and allow the data to decide on the policy interventions, that where people's lives are being, where poor people, however defined and measured, lives could go better from policy, that we intervene in ways that do make those lives go better as those people live and experience those lives, but we keep out of people's lives when we're making judgments about what we think's good for people.
So we keep out of people's lives as a preference, but if we're going to have public policy, it's got to be the right public policy backed up by serious data. I think that's what I've understood.
Yeah, that would be I think that's a pretty good summary. And it's pretty hard to think how anyone would disagree with that, though, isn't it? Really, I mean, it's not.
Yeah.
Why do you think people do? Because I feel like everything I've been saying is so eminently sensible that everybody should agree with it. I mean, where is it? Why is it? Where's the fault? Where's the market failure in the language of economics?
Well, we're going to have to go at this for another hour. I mean, I think partly people like me who are classical liberal to libertarian minded, who then have to be very pragmatic because that's politics. I think we just fear legitimizing more state action, because it's not like there's a shortage of state action at the moment. I mean, you look back at the data and, at least since about 1970, governments have, with a couple of exceptions, run deficits, not surpluses. And we've seen there's evidence we're at the limits of taxation and very often have been broadly at the limits of taxation. So there's part of, I think people like me think, well, I don't actually want the government to do more. I would like the government to do less, because apart from, preferring lower taxes for all sorts of reasons, we seem to be incapable of having a state which does good and does it within the bounds of what the public can afford to pay for it. So I suppose for people like me, we're just, I think we worry about legitimizing state action, and that's what's going on. But actually, I think a practical person in politics has to accept, as I do, that we've got a state and it's quite big and it's going to do things. And if it's going to do things, well, they better be well-informed things backed up by evidence and things which make a difference. A classic example to me, early intervention. I don't like the idea of early intervention in, the 0 to 2 years of age stage, but I think we do know that at 0 to 2 years, brain development is such that if people have not had a successful first couple of years of life, that determines, well into adulthood, how they'll do. So, I sometimes say to my Conservative colleagues, particularly when Andrea Leadsom was standing for leadership on the platform of early intervention, I said to colleagues, if you want lower taxes in 20 years' time, you've got to listen to Andrea Leadsom now on early intervention. And most Tory MPs who just want lower taxes struggled with it. But actually, if we want the government to do less, we've got to have people who are more capable of living their own lives and providing not only for themselves, but for others. So I've given you a longer answer than I wanted.
No, what you've done is you've given me a really super answer, because one of the things we don't do so full-blown cost-benefit analysis should account for all of the future flows of costs and benefits. That's like the principle of the Green Book.
Hard problem, but yeah.
That's the principle of the Green Book. It's in there as a principle. I mean, the practice, of course, is something very different. But one of the things we don't do is account for future downstream fiscal consequences. So if you're thinking of an education intervention like early years, is that we're not thinking about the impact that that's going to have 20, 30 years time when people aren't using public services in the ways that they would otherwise if they didn't have those interventions. Because obviously, as you know, a significantly small number of people are hugely expensive. And the education interventions reduce the likelihood that they become those people that are hugely expensive.
Yeah.
So a proper CBA would actually account for that. But as I say, even having the conversation about it is a start. I think even getting that into the mindset of decision makers and politicians by allowing, people like me on the commission to come and talk to you about these things in a way that SAGE has been able to advise governments on how to respond to the pandemic. is that having a particular perspective on the issue is enormously beneficial in thinking about what policy impacts to implement, you know, or what policy measures to implement. But it just needs to be broader, with a wider range of interests, experiences, and perspectives. I'm kind of making the same point again, but I think that's what needs to happen next. It needs to happen urgently, and it needs to happen before the pandemic's over, because one thing behavioral science teaches us is our memories are really fucking short. Right? I mean, if you like, I mean, not, you know, I mean, but so a lot of what's happening now we think has changed the world forever, right?
Yeah.
And actually some of it will, but you can't judge in a moment of crisis whether it has or not. It's like when you've been ill, like last time you were sick, you said to yourself, I'm going to remember how great it feels to be healthy. The moment you're healthy again, you've completely forgotten what it was like to be sick. And what applies at the individual level applies to some large degree at the social level. We have very, very short memories. So there's a very real danger that all the things that we're discussing now just get completely forgotten about afterwards because they've become unimportant again. So I think the most important thing I can say to you now really probably is whatever we do, is we do it quickly.
Well, Professor Paul Dolan of the LSE, thank you very much indeed for this conversation. I hope anyone watching it has found it as helpful and interesting as I have done. It's been a real privilege to speak with you. I wish you every success as you launch your paper.
Thank you so much, Stephen. Thank you for your time today.